My name is Professor Dorothy Keefe and I'm the CEO of Cancer Australia, which is Australia's national agency for cancer. Our responsibility is to improve cancer outcomes for all Australians, whatever cancer they have and wherever they may be in this country.
As the Health Minister, as the government, we want to do what we can to help improve those connections, to support this type of network, to support the networking of the comprehensive cancer centres that Dorothy is going to help steer between the key big states that will all have a comprehensive cancer centre in time. All of this work just bringing together our understanding of what works in different parts of the country or in different tumour types is going to make your work easier as clinicians and advocates, but ultimately, as we remind ourselves, as Jacinta and Chris's story remind ourselves, ultimately all of that will be to the benefit of Australian patients. So it's a great pleasure to launch the network, and I wish you all the very best for the rest of your day. Thank you.
The Australian Comprehensive Cancer Network was launched by the Honourable Mark Butler, the Minister for Health and Aged Care. It's a foundational piece of the Australian Cancer Plan, and it aims to link all cancer treatment centres across Australia to ensure that every patient, wherever they may be and whatever cancer they have, is linked into the world's best cancer treatment. It will enable people to receive as much care as possible, as close to home as possible, while making sure that people seamlessly move across the system if they need to move to a city to have particular aspects of their care. It also enables cancer researchers, clinicians and consumers to be linked into innovative research and treatment, and it will generate better outcomes for our patients.
Welcome to the Australian Cancer Plan. The plan is designed for use by governments, policymakers, service planners, clinicians, people affected by cancer, cancer organisations and researchers. If you or a loved one are dealing with a cancer diagnosis or need further information, visit canceraustralia.gov.au. The future of cancer care in Australia is one where we can achieve equity for all Australians across world-class cancer outcomes and experiences.
The Australian Cancer Plan was launched at the end of last year by the Minister, and it is the first time we've had a national cancer plan. The idea for all of these pieces of work is that everyone should be able to receive the best evidence-based cancer care wherever they are and whatever cancer they have. The consultation for the Australian Cancer Plan was extremely extensive. We wanted to hear from everybody. We received over 700 submissions, 400 from groups and 300 from individuals. Australia has some of the best cancer outcomes in the world, but those outcomes are not uniform in all populations and in all parts of the country, or indeed for all tumours. So we talk about the Australian Cancer Plan being for all Australians with all cancers, but we do need to focus on the cancers that have the less good outcomes and also on the populations that have the less good outcomes. So we are looking particularly at improving outcomes for Aboriginal and Torres Strait Islander people because they do have a worse outcome for many cancers, and we are looking at other populations where the outcomes are not so good. That includes the very young, the very old, people with disability, people with mental health issues, and so that we're trying to make sure that we make the advances where they are most needed, and that will give us the ability to improve our outcomes even further.
At its best, Australia is the best in the world at cancer care. But not everyone gets access to that best. And that is, I think for me, the central ambition of the cancer plan that Dorothy and her team have put together with all of your support. It is to ensure that every Australian, no matter where they live, no matter their background, and no matter their tumour type, has access to the best possible care in the world, because we should be able to deliver that in a country as wealthy, with a healthcare system as good as ours, with a medical workforce as talented as well trained as ours, every cancer patient should have access to that gold standard. And for me, that was the centrepiece of the cancer plan. What that requires is better networking. It requires the ability for a doctor, a patient, their nurse, their family, their parents, if you're talking about a child, to know the easiest way to get to that best possible care, whether they're living here in Sydney, whether they're in a remote community in the Northern Territory, as I say, no matter their tumour type.
There are some cancers that are rare and therefore haven't had quite as much research as other cancers. So you might think of sarcoma or particular forms of, say, bladder cancer, or particular forms of breast cancer that have particular mutations in them. So there are all sorts of different cancers. Liver cancer, for example, doesn't have a particularly good outcome, and pancreatic cancer is one of the cancers that does not have a good outcome. And so what we're trying to do is make sure that we are researching in those areas and improving outcomes in those areas for people affected by those cancers. There are a small number of what we would call comprehensive cancer centres in Australia, and they're all in the major cities. So the Peter MacCallum Cancer Centre in Victoria, the Chris O'Brien Lifehouse in Sydney, and the Kids Cancer Centre in Sydney. Most other capital cities do have cancer centres that provide most of the features of what you would call a comprehensive cancer centre. All of the different treatments, surgery, radiotherapy, chemotherapy, as well as research and teaching. We're not being exclusive here. We are using in the ACCN the comprehensive cancer centres as the anchor points of the network. But everywhere where any form of cancer treatment is given can be included in the network. After the launch of the ACCN, we have over 100 members. Now, some of those members are individuals and some of them are cancer treatment centres and some of them are comprehensive cancer centres, but all of them are valued members of the network. And the beauty of having a comprehensive network across the entire country is that if a particular treatment or investigation is not available where the patient lives, they can be seamlessly linked to a centre where that is possible, and therefore will be able to move to that place to have whatever treatment or investigation that might be, and then go back to their home place so that they can be looked after there. And it's that networking and linking that is really important for the outcome improvement that we're looking for. Research is a really fundamentally important part of cancer treatment. Cancer is what we would call a research-intensive specialty. We have not solved the problem of cancer universally. We have improved cancer outcomes enormously in Australia over the last 30 years, but we've still got a way to go. And we can't get there without doing basic research and clinical trials. Again, with the ACCN, the idea is that clinical trials will be more available across more of the country. There are already some fabulous clinical trial initiatives that enable trials to occur in more rural and remote areas than has previously been the case. So, for example, the teletrials projects in Queensland and Victoria are really innovative ways of providing access to clinical trials for patients, and that will directly translate into new treatments that will enable better outcomes. The Minister launched the Australian Cancer Plan in November, and here we are celebrating the achievement of one of our foundational activities of the plan. And we can only do that because of all of you here in the room and online. And that is a very special thing to be celebrating. So I want to start with my great thanks to all of you for coming on this journey with us to try to improve outcomes for everyone affected by cancer in Australia. The ACCN is part of the Australian Cancer Plan, and the Australian Cancer Plan is a 10-year plan to improve outcomes and experiences for cancer patients in Australia. Setting up the ACCN was a 2-year goal of the Australian Cancer Plan, and it's actually been achieved in 6 months, which just shows how enthusiastic the entire cancer sector is to make this plan a reality. The next action around the ACCN is to have it fully functional by 5 years, and we will certainly be hitting that milestone. What the ACCN will do is enable us to deliver on the other priority actions of the Australian Cancer Plan. So that means establishing the cancer data framework and the cancer genomics framework and implementing the optimal care pathways across the whole network, which are the vehicles through which we'll be able to deliver the best care.